September's National Sickle Cell Month. Sickle cell disease hits the African American community harder than any other group. According to the CDC, the blood disorder occurs in 1 out of every 500 African American births, as opposed to 1 in every 36,000 Hispanic births. Dr. Jennifer Caudle is here to break down everything you need to know about sickle cell. In fact, she's out of Philadelphia, in the Children's Hospital of Philadelphia. There's a doctor there who has come up with a cure for sickle cell, and they are looking to raise about $5 million to fund the further research to move that forward. And so Alfred Liggins, our CEO of Radio 1, has been involved in trying to help them raise those funds, and so am I. So, Doc, what's happening?
Hey, what's going on?
All right, so you came out here saying you're going to draw. So why don't you...
Wait, yes, I did. I brought my pencil, my Sharpie, and I did. I don't know. This is my first time drawing on TV.
Yes.
But, okay, so let me...
the first time somebody drew something on TV.
All right, so this is the thing. First of all, I got to say this because we all know people who have sickle cell disease.
Or sickle cell trait.
Or sickle cell trait. And I have to say, of all the TV that I do, this is the first time I've talked about sickle cell disease on TV. And
I told y'all,
and this
black show, black network, black host. Go ahead.
Black shows matter. Well, black shows do matter. And
black-owned TV matters.
And this is really so important because this is an issue that affects us predominantly. In the U.S., 1 out of 365 black people have sickle cell disease. So let me explain what a sickle cell is. A lot of people are like, what is sickle cell disease? All right, so this is a red blood cell, okay? So can you see? Oh, yeah, there we go. So it looks kind of like a donut, okay, with the hole left in. That's good. We want a nice little donut red blood cell running through our blood vessels because it's going to deliver oxygen. And that's what we need because tissues need oxygen. When you have sickle cell anemia, this is what happens instead to your red blood cells. They become the shape of a sickle, which is this little guy here. The problem with that, you say, oh, those are skinnier red blood cells. That's better. Absolutely not. They become stickier and they stick to the red blood cells, which is what causes the pain, which is causes the organ problems and all of the pathology that we see with sickle cell anemia. So it really comes down to the shape of the red blood cell, and that's what happens. And
when folks go into high altitude, how does that somehow affect?
Well, absolutely. It can make sickling worse, first of all. You might have heard of the sickle crises. Let's talk about symptoms, though, right? So you say, okay, so the blood cells are sickled. What does that mean? It means that sometimes people get a lot of pain because those red blood cells are sticking to the blood vessels.
Like hospitalization pain.
Hospitalization pain, bone pain, severe pain.
So painful swelling of hands and feet, fatigue, or fussiness?
Fussiness.
What is fussiness?
Well, so that just means just uncomfortable. These are symptoms we often see in children.
Yellowish coloring of the skin.
And that's often from jaundice. When a child is diagnosed with sickle cell, often some of the earlier symptoms are these, okay? And that's really, really important to note. But as we get on in life, we can get strokes, we can get heart attacks, we can have bone pain, joint pains, we can have anemia. There's so many problems that come with sickle cell disease. And I'm so glad we're talking about it.
And why is this more prominent in the black community, though?
It's a genetic thing. It really is a genetic thing, and that's one of the things that's really important to note. We don't get sickle cell by coughing or sneezing on someone, right? It's passed through genes, so it's inherited from families. And interestingly enough, we know that in this country, more African Americans have it than others. But again, Central South Americans can get it. Those who are from the Middle East or Caribbean, it's an inherited genetic disorder.
And I want to mention, I want you to really address something here.
Sure.
This is very personal for me. My best friend, Dr. Carlton Haywood Jr., is a biomedical ethicist at Hopkins.
Sure.
He has sickle cell. It's been one of the things he's worked on and been active with his entire life.
Sure.
Talk about how important it is for parents to be advocates for their children when it comes to the early years of having sickle cell, pain management and things like that. I've seen my friend go through this his entire life and how difficult it is and how parents don't often know how to advocate for themselves.
Well, I'm so glad that you mentioned that because I actually talked to a childhood friend of mine last night, and I'm going to give a little shout out. So we all, those of us who have family and friends with sickle cell, we almost live it through them.
Yeah.
And it is painful.
Yeah.
And we're not going through it. It is absolutely devastating. There's a number of issues. Yes, parents need to be on top of this. And remember, there is genetic screening for sickle cell trait and disorders. So there's a genetic screen that all children, newborns, should be getting to tell whether their child's going to be at risk. So that's one way to tell. But the biggest thing, if you have sickle cell disease, is early care. You got to get those eye exams, those lab tests. You've got to get kidney evaluations and things like that. That is so important. Immunizations, your shots. You might need penicillin or medications to prevent infections. It really is a whole comprehensive care that really is needed. And yeah, you know, there's sometimes stigma.
Yeah.
Sometimes those with sickle cell anemia are not treated. And this is actually what a friend of mine was saying last night. I asked her, I said, well, what have been your experiences? She said, you know, sometimes people just don't believe the pain I'm having. having.
They treat you like a drug
They
addict.
think
that
I'm
you're
a
asking
drug
for
addict.
morphine. Yeah.
That's literally what she said. And honestly, one of the missions she wanted me to get across, and Glenda, thank you, honey. I'm telling it right now on News One, is that a lot of people feel that they're being confused with being a drug addict.
Yeah.
When really they've got really major pain. This is a real disease.
Right. You mentioned genetic testing for newborn children,
Yes.
but you also mentioned that some of us can carry the trait. How can we find out whether or not we carry that trait?
That's a great question. So you can get a blood test. And actually for a lot of athletes, like I do, I'm a family doctor, so I do a lot of pre-sports physicals and things like that. A lot of schools, colleges, high schools want to know if their athletes have sickle cell trait or disease, so we can do blood tests to test.
So
in
just
fact,
go to the
and-
doctor and
and-
say,
Go to
I
your
want
doctor.
the blood
And-
test for
Yeah.
sickle cell?
And in
Go to your
fact,
doctor.
Florida State, I believe, had a football player who he was a twin. He had a brother who played at Rice who died. And they later found out it was his sickle cell that actually played a role in his death. So yeah, and that's so the NCAA, they've actually
Yes.
instituted sickle cell testing.
Yeah, I have to fill out paperwork and have to get the blood test off.
Where
of the
can folks
children.
reach your doc?
Oh, at Dr. Jen Caudle. And let's raise money for research, and let's get our kids and our family members and our friends tested and treated appropriately, and raise awareness about this.
All right,
so
Doc.
important.
Thanks a bunch.
Thank
Hold up
you.
your drawing again so people can see your
I get excited about
your
this.
Picasso
Good
skills.
cell, sickle cell.